and Arkansas State Dental Association. Dr. Turcios is originally from El Salvador. He is very active and trying to improve the dental health of the Hispanic community in Little Rock. Please help me welcome Dr. Jose Turcios.
Hello, good morning, everybody. So my presentation today is, the name is called Oral Manifestations of HIV. Pretty much what we're going to be talking about is, a very brief description of what HIV is, modes of transmission. Most everybody's going to be familiar with all these things. A little bit about statistics, and then we're going to get to the main focus of the presentation, which is going to be the classification of the lesions that we can find in the mouth. And we're going to close talking a little bit about the role of oral healthcare providers or dentists in the health of the HIV positive patients. So what is HIV? We're going to talk a little bit about the definition, and it's a virus that attacks our immune system so that it weakens the body's capabilities to fight organisms capable of causing disease. HIV is primarily transmitted sexually, but can also be acquired through contact with an infected person's blood, as everybody knows, transmitted from mother to child during pregnancy, during birth, or during breastfeeding. And as most everybody knows here, it can take years for a person to develop symptoms. And as of right now, there's no cure for HIV. Signs and symptoms. Initially, we can find fever, sore throat, headaches, skin rashes, inflamed lymph nodes, and in general, we're going to find signs and symptoms of the common cold or the flu. Person may get these, not all of them, may get some, may not get others, and it can be as soon as week, 2 weeks after the contact, after they get infected. It could be a few more weeks after that, and a person may think, well, it might be this flu season, and well, I just got the flu, and not know that it's actually the HIV that they've been infected with. Continue with the signs and symptoms that can happen years later. Lymph nodes are still swollen. Person may develop diarrhea. With these comes unintentional weight loss, shortness of breath, and fevers. After a few years, even after that, if a person goes untreated, and then the disease can progress to what is known as AIDS, which is the acquired immunodeficiency syndrome, which is the later stage of the disease. This, of course, is a person that's very, very sick, might have night sweats, shivering, fevers of over 100 degrees, persistent oral lesions, and also the fatigue is present, because also continuous diarrhea, weight loss, shortness of breath, and blurred vision can develop too. We'll talk a little bit about the modes of transmission of the disease. First, we're going to talk about the myths. Everybody, there's myths about about how the disease is transmitted, how you can get HIV. Unfortunately, even now in the 21st century in America, there's a lot of misinformation about how to acquire, how you can get infected with the disease. Among the myths include that hugging a person, you're gonna get HIV, which we know that's not true. There's myth about a mosquito bite that bites a person that's HIV positive, and then that same mosquito comes and bites me, then I'm gonna get HIV. That's also a myth. Also, through a kiss, if you kiss a person, you're not gonna get HIV, and I'm gonna talk a little bit more about that. But it is a myth that the casual contact with a person in general, or a casual kiss, or displays of affection, that you're gonna get infected. That's completely not true. The reality is that HIV can be found in some body fluids. It can be found in vaginal secretions. It can be found in semen. It can be found in blood, the breast milk of the mom's breast milk that's infected, and it can also be found in blood, what's called blood-containing fluids. As you can see, it doesn't say that it can be found in saliva. Saliva itself is not, HIV virus has not been able to be isolated of pure saliva, so it's not in saliva. Now, as we're going to see later, if a person has really bad oral hygiene, has anybody heard about gum disease, gingivitis? The main sign or a main symptom that a person can have is, well, my gums are bleeding. We said the HIV is in the blood, right? So that's where oral hygiene is very important, because like I said, and I'm not trying to cause a controversy or trying to say scare people, but if you need to have oral hygiene, and the persons who are HIV positive know, they've been told about this, that they need to take care of themselves, right? So besides the overall health, I think oral hygiene is very, very important too. Because, like I said, as we're going to see, some of the lesions that can happen in the mouth also, that can cause also bleeding, not just from gums that are from oral hygiene, but it can come from the lesions that can be found in the mouth. So that's why it is very important, oral hygiene. HIV, as we know, is spread primarily by sexual contact, by not using a condom, and in general, unprotected anal sex carries more risk than unprotected vaginal sex. Oral sex can also be a risk, but it's a lower risk factor, but it's still a risk. It can also be transmitted through drug use, by sharing needles with an HIV infected person, needles that are used for equipment to prepare illicit drugs for injection, or like we said before, the third mode of transmission can be through birth, by being born to an HIV mother, and that can happen during the pregnancy itself, during childbirth, or after childbirth, if through breastfeeding. A little bit about statistics, and this is not my forte, so most of the people here from the Department of Health, are more knowledgeable about this. But I just wanted to show, this is like a map of the United States, and this is as of 2008. This is the most current I could find from the CDC. But Arkansas, as you can see, is in purple over there, and it's right in the. What this is showing is the rate of infected persons according to the population, and Arkansas is in purple there, which means there's an average of between 200 roughly to 300 and something infected persons for every 100,000 people. That's where Arkansas is at. This is another slide from the CDC. This is not taking account. This is like a national also average. This is not Arkansas, but that breaks down the race as it relates to the what kind of metropolitan area and the people are located. Most important to us are the two on the right side, which is the one in the middle is where there's a population concentration between 50,000 to 499,000 people, or non-metropolitan area. Those are mostly the ones that apply to Arkansas, because we don't really have any metropolitan areas that are much bigger than 500,000. But in purple there, it's African American, and this is in yellow it's white, and green is Hispanic. This is another chart that talks about how the infection relates to the mode of transmission. The higher bars there in yellow are people who got the disease through male-to-male sexual contact, and pink is through heterosexual contact, and blue, which is the third one, is through injection or illegal drug use, sharing needles, and the smallest one there in orange is male-to-male sexual contact and also sharing use of needles for injection. So it's a combination there. This is more related to Arkansas, and this is also talks about the relationship between the modes of transmission, and majority 54.7% says that it was through male sexual contact with another male, and then it's heterosexual contact. That's pretty similar to the national. Now, as far as this is, it says estimated AIDS diagnosis. Notice this is not HIV new infection. This is people who are in the later stage of the disease, that have already gone into AIDS, and this is distributed by race or ethnicity. According to this, and this is also from the CDC, there's more white in Arkansas than black African American, but take into account that this is through 2008. That's the one I couldn't find anything more recent from the CDC. This, I'm sure it may have changed, and like I said, most other people who are here, they can attest to that, and they are more knowledgeable in statistics than I am. Now we're going to talk a little bit about the mouth, which is mostly what that was more like a brief introduction, and this is what mainly we're going to talk about. Talk about the oral lesions that can be found in HIV patients. There's different classifications that can be done. This is one that I particularly use, and this is based off University of California in San Francisco. I heard there's some people from the Bay Area here. So that's that. I'm got my dental education in California too, so I'm familiar with California and the Bay Area, and this is the classification that I like to use. Like I said, there's different classifications for the lesions that can be found in the mouth. We're gonna talk first. Let me go back one. There's they can be classified as from according to the agent that's causing the disease, and according to this, we can have lesions caused by fungus, lesions caused by viruses, lesions caused by bacteria, and neoplastic lesions or lesions caused by cancer, different types of cancer. And there's another category of lesions that cannot be really put into any of the other ones, so we just naming other lesions. First, we're going to talk about lesions that are caused by fungus. First one that we're going to talk about is something called pseudomembranous candida, and that's characterized by some white patches that can be formed in the mouth, and they are covering like an underlying red, very red, angry mucosa. There's a very typical clinical characteristic to this disease is that to this condition is that you can, with a gauze, the clinician can wipe off that layer of the white patch layer, and that mucosa underneath starts bleeding. And this is if a person usually this is called like it's an opportunistic infection, like most infections that will cause problems in an HIV patient. And this is not, of course, this is not something it's going to be found just in an HIV patient. This can be found in in other populations, like somebody whose immune system is very depressed, but in an HIV patient that is a known HIV patient, and we see this is associated with a very low T cells and CD4 cell counts, and almost always this is going to put that person into the classified as an AIDS patient, so meaning that the disease has progressed to the later stages. This is another type of fungal disease. It's called erythematous candida, which is caused by the same agent, but we don't see the white patches in this one. Something called angular cheilitis is also caused by fungus, and that's characteristic of this is that the corners of the mouth, you get those lesions that like it can be open and bleed, and that's usually caused also by this kind of agent. And the next one is something called histoplasmosis. You can see that lesion on the lower lip there, or some underneath the tongue also. All these are caused by fungus, and these can be found. This particular histoplasmosis, I think it's important for us to know here, is caused by a fungus called Histoplasma capsulatum, which is actually a disease that's very prominent in Arkansas. This is like a map showing the darker the region, that means the higher the concentration of the disease in the United States. So as you can see, the eastern part of our state, there is a very high rate of the disease present. So this is, and then the rest of the state follows into the next category of concentration of the disease. And again, this is not just found on HIV patients. This is mostly found in, this is a fungus that it can be in bird or bat droppings, and it can be found in caves and things like that. So a person can inhale the spores of the fungus, and the infection can go into their respiratory tract, in their lungs and things like that, and sometimes can have manifestations in the mouth. Most of these diseases doesn't mean that they are all just mouth disease. They can be found cause lesions in the lungs, respiratory tract, but sometimes they can have manifestations in the oral cavity too, in the mouth. That's another one. it's cryptococcosis. Treatment for all these lesions is antifungal agents, and there's different kinds. It's not the objective really in this presentation to go into detailed treatment of all these, but you know, there's many different antifungal agents that need to be used to treat these diseases, and that's determined whether it's just a localized treatment on the area of you know, if we notice something like this, of course that patient needs to have like a full workup and to find out if there's, you know, other places where the disease is present and needs some more systemic treatment. That was about the fungal lesions. We're going to talk a little bit about lesions caused by viruses. The first one we're going to talk about is the common cold sore. And this, again, not found just on HIV patients, but in HIV patients, since they have a depressed immune system, especially if they are not undergoing treatment, they may find that these lesions show up very often, more often than in the regular population. And these are some vesicles that, you know, form in clusters, and eventually they get ruptured and form a little crust, and this is what, you know, what most people know as a cold sore. The second one that we talk about is called herpes zoster, which is also known as shingles. It's caused by the same viral agent, the herpes simplex virus, and you know, that pretty much all humans have come into contact with this virus, and but it stays dormant in our body. Sometimes it never had it doesn't have any clinical manifestations, but when a person has again, their immune system is depressed, then the virus you know, finds a way out and starts showing clinical manifestations. The characteristic of this is like in shingles, you know, the lesions don't pass the midline. They just show on half of the body. It can be in the limbs, in the back. It's same thing. The same pattern follows in the mouth. Notice how right at the center of the mouth, the lesion is confined to that side and it doesn't spread over to the other side. That's very characteristic. Lesions also caused by virus can be lesions caused by the human papillomavirus. Human papillomavirus has been linked to oral cancer too. So if a person goes and treated, it can get ugly and cause you know, even cancer. Something else called cytomegalovirus. I don't mean, I'm sorry, but you know, everybody's like grossed out right now. This is right before lunch too, huh? Cytomegalovirus is usually does not have oral manifestations. It's more like a disseminated disease throughout the body, but when they have a oral manifestation, if I see a patient with something that, I mean, most of the times probably I won't be able to do a diagnosis of this without doing a biopsy or doing, you know, I'm not just going to look at it and say, oh, this is cytomegalovirus. But, you know, somebody who shows this kind of oral lesions probably will have the disease disseminated throughout the body. There's also a condition called hairy leukoplakia, and this is also characterized by some white patches on the side of the tongue, and it's associated with a virus called the Epstein-Barr virus. The same virus causes something we know as most people just know as mono. It's called mononucleosis. It's also known as the kissing disease, there's a very characteristic is the person is very tired all the time, and that's why I put that slide over there, and that can be found, that virus can be found in saliva and can be transmitted through saliva too. Now moving along, we're going to talk a little bit about diseases or conditions caused by bacteria. The first one we're going to talk about is something called linear gingival erythema. Before it was known as HIV gingivitis. That term is not really used anymore, but that's how some people know it. Something that's very characteristic is that what we call the free gingiva or the gum area that's right around the teeth gets really red, so it forms like a line around the teeth that's really red, and that means the gums over there are really inflamed and they can bleed very easily. It's caused by bacteria, but it's not a lot of plaque associated with this condition. So if I see a person that has very little plaque when they come for their checkup, but they have this very distinctive pattern, then that can be a suspicion that person might not know. This is something that can actually show up in early stages, and that person may not know that it's HIV positive, and so that will be a sign of a little bit of a flag to maybe do some further probing that question maybe. And that's where like they were talking about, you as a healthcare provider, you might want to talk to that person about and try to find out about what risk factors that person may have, and see if may need to be tested if they don't know that they are. But this is very, very characteristic of HIV. There's something called necrotizing ulcerative periodontitis. I mean, that looks pretty bad, right? That is caused by neglect in oral hygiene. Bacteria just find that just go crazy, and they start destructing all the support tissues around the teeth. Can cause bone loss. Teeth are supported in our mouth. They have roots. All our teeth have roots that are supported by bone that's covered by gum tissue. So when bacteria find it very easily to colonize that area, and they start destructing the bone, and then the roots of the teeth, start being exposed, and then, these teeth, are pretty hopeless on their diagnosis, and teeth will get loose because they don't have any support, and then the treatment of that, of course, is debridement of all that, and teeth that are hopeless need to be taken out because you can't have an infected tooth there, and then oral hygiene is the main thing here. There's also another condition called bacillary angiomatosis. It's caused by, there's a couple of bacteria associated with it. Let's talk a little bit also about neoplastic lesions, or lesions caused by cancer. Sorry. First is something called Kaposi sarcoma. There's different kinds of Kaposi sarcoma. This is also a kind of cancer that's not just HIV, exclusive of HIV. It can be found in other populations, but when it's found in the mouth, in a patient, it carries a very high mortality rate, more so than in any other part of the body. It might have to do with, and then the person will die of cancer. It might have something to do with the fact that the oral cavity is there's a lot of blood vessels, and then the cancer can find many ways to spread to other and metastasize and cause problems somewhere else. But it's not just in the mouth that can be found. It can be found in other parts, but like I said, if it's found in the mouth, carries a very high risk of death. There's also another type of cancer that can be found in the mouth in HIV, more in HIV patients. It's called non-Hodgkin's lymphoma. It's a cancer of the lymph nodes, or the lymphatic tissues. And we also have lymphatic tissue in our mouth, and so it can be found. The oral healthcare provider can find it too, can see it, and most physicians, they sometimes they don't look inside the mouth, but dentists, we're in the right there, and that's all we look at pretty much. So this is something that can be seen there. Now we're going to the last category of lesions, which is called these are agents or conditions that cannot be put into any of the other categories. We're going to talk pretty much briefly about them. First one is something called the aphthous ulcer. This is what most people know as a canker sore. This can happen because of an injury that we have in our mouth, maybe with some food, maybe a sharp edge of it, chips, and then you injure your mouth, and then you develop an ulcer. There's really no treatment for it, because it's not caused by bacteria or virus or anything like that. You just pretty much treat the symptoms. Try to, if that area, what I tell my patients when I see these is, but it hurts, it cannot eat, because if anything touches it, it hurts. Pretty much the only thing you can do is maybe apply some of that topical anesthetic they have at the store, Ambisol, Oragel, anything like that. Numb it up before you eat, so you can eat comfortably, and normally they will go away within 2 weeks. Pain medication, but the topical treatment, I think, works better than actually taking a pill to make the pain go away. There's something else called thrombocytopenic purpura, and pretty much what happens in this condition is that our immune system attacks its own platelets, and which inhibits clotting. It can be this is actually as very mild as this, or it can be, so what happens, or it can cause even internal bleeding on very, in a very severe cases. What happens is that our body's capability of clotting is inhibited because our platelet counts go very low in our blood, and so it's any cut or anything like that, it will bleed for a long time. There's another condition called salivary gland disease. This is what it causes is xerostomia, or a dry mouth, known as dry mouth. Dry mouth will for sure cause decay, because our saliva is our unnatural cleansing agent in our mouth. Something, when we get food in our mouth, with saliva itself will, eventually, not completely of course, but will help to rinse that off and that from sticking to our teeth. So when a person has a very dry mouth, or not producing very much saliva, or no saliva at all in some cases, that will cause decay, and it's very typical that the area that's going to be more susceptible to decay caused by a dry mouth will be in the regions right around the gum area, and sometimes it can cause rampant decay like this one. It can which can be very serious. I mean, this person of course is not gonna, those teeth are not, there's not much that can be done, and this the serostomia or the dry mouth can happen with or without the salivary gland enlargement, like what you can see there on the left side. In that, when the salivary glands, particularly, is what we call the parotid gland, which is right over here on our cheeks, is sometimes it's caused by some cysts that form on that gland. Now I want to talk briefly about the role of dentistry in all this. The first, I think, it's educate. Educate first when we find a patient. Educate them about their disease. It's very important that somebody who is HIV positive understands their disease. One reason or another, sometimes patients don't understand very well what's wrong with them, or like I heard somebody say, well, I'm maybe in denial that I have the disease or something like that. Well, you need to, as healthcare providers that we need to educate the patient. We sometimes have to educate our staff in our offices. Like I've had to educate my staff in my dental office, because like we said, there's a lot of myths associated with the disease. And there's the disease still in 21st century. It carries a lot of stigma, like everybody knows here. And so the first role is education, and it's a very important role. We, as oral healthcare providers, we need to get educated ourselves, because we need to understand the disease too and how we're going to help the patient. We need to educate the community, and in our practice we try to do that. We try to get involved when there's a community event that they invite us to talk about these or any other topics. We need to try to educate the community so they understand what the disease is, what the myths are, and what is not really true about the disease, and what the facts are. I find that it's also very necessary here in our state to educate other oral healthcare providers, because I'm sorry to say that even at this point, there's some dentists and things and oral healthcare providers that still don't know all the facts about the disease. And unfortunately, still, they think of an HIV patient, they think in terms of like a layman, like a lay person that does not know the disease, and they kind of like react like, trying to, well, I'd rather not see this person, or things like that. Unfortunately, that still happens. The second thing that I think is important is prevention. Once we educate the patient on their disease and help them understand how they can prevent some of these things that we saw, some of these pictures, from happening. We need to observe whenever we see some lesions like this and document them. If this is not just for HIV patients, for any patient, and if like most of these lesions, with treatment they will go away, but if a person is not diagnosed and has these types of lesions and it's very hard to treat, then that's that's a sign that something else might be going on. So it's our responsibility to document this, and whenever a patient has a lesion in the mouth that has treatment and does not go away within 2 weeks or so, then then we need to start looking at something else. So that's why it's important to document in our patients what the things that we find. Refer when necessary. When we see something like this, we need to, refer to have the patient, maybe, if the person is not HIV positive, maybe refer them to get tested, and maybe they need to, if a patient is known HIV positive, and we see some things maybe the dentist can treat, with medication. Some things is not in our scope to treat, because like I said, sometimes they have the disease disseminated, and then they need more, comprehensive treatment. And then on HIV patients, our role is help them maintain their oral health, through explaining, and this has to do with education to the patient, and explaining to the patient how important it is for him or her to come back and get their regular checkups and get their teeth clean, get their cleanings, checkups, and make sure that we keep their mouth as free of disease and bacteria as possible, so that they don't have a complication on that can come from those agents. And that's a very important thing that I think needs still to be understood. This still needs to be explained to many healthcare providers, oral healthcare providers more specifically, because like I said, sometimes they still some people still don't understand the disease, and don't understand that there's a big need also for these patients, to get treatment. That concludes my presentation this morning, and thank you everybody for your attention.
We have one question.
Okay.
If there are any other questions, if you'd like to write them down quick, I'll be happy to collect the cards.
Okay, I'm going to start with this first one. Other than STD, how is HIV transmitted? Well, like we said, there's mainly there's 3 ways that it can be transmitted. One, and that's the most common one, is through sexual contact. The second one is through the use of drugs, or not the use of drugs itself, but the use of infected needles, sharing needles that are used normally for illicit drug use. And the other most common way to get the disease to be transmitted is from mother to child, during childbirth, during the pregnancy itself, or through breast milk. The next question says, do HIV patients need to be seen more than 2 times per year? It depends, to be honest with you. But I would say that has to be the recall system to go to the dentist to get cleanings. It has to be customized to every patient. There are some patients that even that are not HIV, completely healthy, clear health history, they need to be seen more than 2 times a year, because there's some people that just form more plaque than others. There's people who are form tartar buildup very, very fast, and these people that are completely healthy, and it just depends on how our oral flora, the bacteria in our mouth, is composed. And there's some people that don't form any calculus at all, that I almost want to tell, well, you can come back in just a year, you don't need to be seen sometimes, but I don't say that, but because the guidelines are that need to be seen every 6 months. But I think that needs to be customized to every patient, and I think there's some cases where I would definitely say, yeah, you need to be seen more than 2 times a year for your checkups. There's another question. It says, I have all them symptoms, but not the bleeding in the mouth. Do I need to be tested again? I am not sure what symptoms. I don't know if we're talking about all the diseases here, but not bleeding. I mean, if person already knows that it's HIV positive, I mean, I don't think they needs to be tested again. You might want to, see your doctor and talk to them about this, and maybe you need to be assessed on what stage of the disease you're on, if you're under treatment, maybe. And maybe if they need to change the regimen of your treatment, maybe they need to be, like I said, reassessed on what stage your disease is. But I don't, as far as testing itself, I probably not need to be tested again. There's there's another question that says the cryptococcosis or any of the diseases can be caught by sharing cigarettes. Honestly, I don't know. I'm being honest with you. I don't know. It can be, probably, if I would say the fungal infections, probably not, because those are mostly transmitted through the spores. I know you cannot get HIV from sharing a cigarette because maybe there's some saliva in there, but it's not in the saliva. But some of the diseases can be found in saliva. Yeah, some of them can be transmitted.
We get any of that from smoking behind each other. That's my question.
I would compare that to sharing a toothbrush with somebody. I mean, you're putting something in your mouth that somebody else is putting in the mouth, I would not recommend it.
Okay, thank you, sir.
Okay.
And,
Okay, I guess this is the last one. I got this last question. Can any of the viral infections or bacterial infections be spread by oral sex? Which ones? Well, not that I know of. I mean, as far as, well, let me change that. The viral infections, for example, herpes definitely can be spread through oral sex. I'm sorry? The question says if any of the viral or bacterial infections can be spread by oral sex, and the answer actually is yes. And let me switch it completely. The answer is yes. Maybe not all of them, but some of them can be. For example, herpes can definitely be spread if somebody has the lesions in their genital area and that person receives oral sex from somebody, that can be easily transmitted to the other person's mouth, or vice versa. Can be spread from the mouth to the genital area, or from the genital area to the mouth. Any of the viral diseases pretty much can be transmitted like that, or bacterial. The bacterial lesions that I showed you are typical of the mouth, so that's a little bit, may not be spread through the genital area, but definitely you can spread them from one person to another one. Yes, I mean, it's bacterial infection, so it can definitely be spread. Mm-hmm. Yes. Okay.
Okay. Now, I mean, you said that it can be spreaded on like that, but how you cure that if you did contact? So, I'm talking about that mouth stuff.
Uh-huh. How?
Yes, sir.
Well, pretty much, it's caused by bacteria or by viruses. So if somebody, for example, has one of those lesions in their genital area, and those bleed and things like that, and that other person is, somebody else gives that person oral sex, the virus is transmitted to your mouth, and then it can cause, lesions in your mouth too. So, and that actually before there was two different types. It was thought that it was two different types of viruses that caused. There was a classification known as genital herpes and oral herpes. Now you cannot really tell one from the other. It's because of the change in sexual practices. Before, they were known as two different kinds of entities, but now they are known, it's just herpes. You call it oral herpes or genital herpes only to talk about where the lesion is present, but it's the same virus.
Okay. One quick question, if it's a quick question.
I want to congratulate Dr. Turcios, but a beautiful presentation, and I want to congratulate all the people who organized this event. It's the first time that a Latino is represented.
Thank you very much. Thank you very much.
Okay. Thank you, and Dr. Turcios?
Thank you very much.
Thank you.